Hi, I'm Dr. Brian Everidge, your local Cold Springs area chiropractor. And today I'm going to be discussing whiplash injuries and how to prevent your injuries from becoming a chronic recurring issue in your life and how to best address and rehab your whiplash injuries. When the neck is injured in a whiplash type event like a car accident or a slip and fall, the superficial muscles in the neck will go into spasm to protect the nearby tissues, typically the deeper muscles and ligaments of the neck from further injury. In short, this is a very good thing that your body is doing. But if movement remains restricted in the deep neck flexor muscles that are really important for maintaining your posture, they can become deconditioned. And as a result, the deep neck flexor muscles will weaken, and the superficial muscles that normally control voluntary movements of your neck will have an added work stress, resulting in further weakening of the deeper structures and muscles of the neck, setting up a vicious cycle that can lead to prolonged chronic issues and prevent full recovery from your whiplash injuries. That's why it's important to engage in a home exercise program and while you're working with your physical therapist or chiropractor to strengthen the deep neck flexor muscles and put them back to work so you can get back to a normal life. A simple exercise to start doing at home when it's considered safe to do so is isometric contraction exercises, where you would just press on your head and push in without moving the neck. This is not a movement exercise. Again, it's isometric. So you're just going to be adding resistance without movement. You would hold for 5 seconds. Maybe you do 3 sets of 10 with these. And you can also grab the back of your head because we have flexion, extension, lateral flexion, and rotation. So those planes of movement, we want to add some resistance. So we would do flexion, holding 5 seconds, relax. Extension, holding 5 seconds, relax. Lateral flexion, again, this movement, but we're not moving the head. We're just providing resistance for 5 seconds, relax. Resistance 5 seconds, relax. And then we got rotation as well. So we would just rotate in with some resistance. And if this is painful, obviously you want to stop, or maybe you feel some mild discomfort. And obviously we got the other side. So all planes, flexion, extension, left and right lateral flexion, as well as rotation. So you would do, let's clarify here. We're going to do, maybe start off with 5 sets of holding for 5 seconds. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And so on and so forth through all the planes of movement. And do that 5 times. See how you feel the next day. A lot of times people who have whiplash injuries, they feel dizzy, they have a little nausea. They just feel this general ache and soreness. And maybe this is all the movement they have. They're not going through full normal ranges of motion. So you have to start off with baby steps if you have a severe, moderate to severe whiplash injury. So this is a good start, and there's further exercises you can do, but if you have a bad whiplash injury, this is a good place to start as it prevents the deeper muscles in the neck from getting deconditioned. A common problem with people after an injury to the neck or poor posture, with a lot of people looking down at their phones or at laptop computers, is they get this upper cross syndrome where the shoulders get rounded forward and the head comes here. This is a result of weakness of the deep neck flexor muscles. For every inch the head goes forward, it causes a lot of stress and tightness in the upper back and neck muscles that help to pull that head back. So applying resistance type training early on to help with recovery from your whiplash injuries is essential. So I hope you found this informative, and in the comments, leave a few questions. If you have any questions, I'll be happy to address them for you. I'm Dr. Brian Edwards. If you want more information on whiplash injuries and how to recover from them, you can go to my blog at drbrianedwardsblog.com, and there's some good information there about how to manage yourself after a car accident or whiplash injuries and certain exercises to do in other scenarios. So hopefully you found this interesting, and I'm Dr. Brian Edwards saying have a great day.